The overall goal of this procedure is to determine signature covariance pattern imaging biomarkers of neurofunctional brain disorders. This is accomplished by first obtaining single-volume brain scans of a set of clinically pre-diagnosed patients and an age and preferably gender-matched set of normal controls using modalities such as PET, SPECT, ASL-fMRI, or VBM-MRI. The second step is to spatially normalize the images to a common stereotaxic template. Next, a multivariate technique, the scaled subprofile model of principal component analysis, or SSM-PCA, is performed, and the output principal components, or PCs, and their corresponding subject scores are examined. The final step is to determine the best PC or combination of PCs that define a covariance pattern that discriminates patients from controls. Ultimately, the covariance pattern may be used to score individual prospective subjects on their expression of the disease.
Advantage of this method relative to some of the popularized single voxel comparative techniques is the ability to identify and measure the activity of brain networks. These are distributed regional covariance patterns in the brain. Most importantly, it allows one to measure the activity of a given network in the brain and to summarize it by a single number. That is a major attribute for clinical investigation.
This method can help answer key questions in the field of neuroscience, such as identifying the metabolic networks for different neurological disease that present similar symptoms in the early stages of disease progression.
The implications of this technique extends